How is our sitting reducing our health or improving our health?
Okay, so actually, when you sit, you know, some people sit like this.
My people.
And then you see your lungs are like compressed, and you get a minimum amount of oxygen into your system.
Wow.
That is number one. Then
Sitting
up straight. Then the second one is that 70% of all directors and retirees that use chair to work, they have what they call spondylosis. Or some kind, maybe cervical spondylosis, some kind, because they've messed up their spine and the structure and the sleep disc, and they suffer with pain till they die, except maybe to do a surgical correction. And all those could be prevented. I just completed MPH, that is Masters in Preventive and Promotional Medicine. And since then, I'm just a brand new person. And I have to kind of lead by example. Even the way I'm sitting, you can tell that I'm trying my best.
I took a relative to an orthopedic doctor, and he puts a iron chain somewhere, dragged her legs because he's trying to give her a posture back. How rigorous is the process to regain wellness if you lose posture, if you lose it over time?
So the most important thing is that don't lose it in the first place. Let's
Very
not
important.
worry about the people that have lost it.
Yeah, can we talk about, just give us a snippet of your book titled Everything Heals. Everything like what, and what?
Okay. So when I moved back to Nigeria, you know, it was rough initially. And I thought, if something happens to me, why did I come back to my country to say I'm coming to help transform the healthcare sector of my nation? I thought, okay, let me write a book as God gives these messages to me. And I just heard that everything can heal you. So just as I was starting to talk before, ask yourself a question. As I'm sitting, is this sitting posture healing me? Now, water is medicine. We know it. But we don't take water medicinally. We take water when we eat or when we are thirsty, and by then there's already so much damages done in the body. Yes. So water heals. Okay, think about it. Your sleep heals you.
Yes, I agree.
Yes, it heals you completely. So if
Then,
you're
like too much sleep?
Yes, there's something like too much sleep. So the study shows that anything less than 3 to 4 hours, less than 3 to 4 consistently is as bad as 12 to 14 hours consistently for your age group.
Wow.
So there's a sleep requirement for infant, toddlers, and
Let
teenagers.
me ask you about food
etc.
again, because I mean, we have little time left. People always complain about carbohydrates, too much carbohydrates, and most of our food seems to be carbohydrates. So when you say eating healthy is cheap, I'm thinking, yes, but they will tell you these things will make you big because carbohydrates convert to sugar. So we Africans, we run away from these too much carbohydrates. Please, could you tell us, should we keep running away from these carbohydrates or we should consume these carbohydrates?
Moderate it.
Our grandparents grew up on carbohydrate because they needed the energy to trek to church, to farm, to every single thing. So they burned those calories. You know, in lifestyle medicine, we say what you don't burn will burn you. Yes. So for example, if you have all those calories in your body and you don't burn them, it's going to turn to diabetes. And then you have to be on drugs for the rest of your life, risk amputation, blindness, complication, and death from diabetes. So when you, in lifestyle medicine and preventive medicine, you always go to the future and say, you know what, I don't want to live like this. I don't want to retire and replace my job with hospital visits. So then you just say, you know what, there's something I can do. This is my contribution to my healthcare. And then you now start adjusting. Okay, let's say you needed, when you're younger, you did 1,000 grams of carbohydrate. You're not burning it, you cut it down. So it's not elimination, it's reducing. And then I want to also add that most Nigerians don't know what is carbohydrate based on in our clinic. All the salad you eat is all carbohydrate. Beans, all carbohydrate. Yes, they're vegetable, but yes, it's vegetable, but the majority high in carbs.
Miriam says some of those things and they confuse me because vegetable not supposed to be sugar.
Auntie, help us understand. So some of the leaves we eat actually have carbohydrates. So if we eat that, we don't need to eat all the carbohydrates. What you're saying?
Yes, you can replace your carbohydrate with
leaves.
With leaves.
It's not filling.
It doesn't have to feel.
It's not even exciting.
Okay, think about
But
it.
gauge
See, there's a thing in
You have to
Nigeria.
gauge.
You have to gauge.
You
Nigeria,
will
have
eat
to
yam.
gauge. You will gauge. How you not gauge?
So you can gauge with plantain. You can gauge with healthier choices. See,
Sweet potatoes.
I have friends that take 10 cubes of sugar and nothing is wrong with them. Go to the hospital, check. If you're fine, I can't change your lifestyle. But if this amount of carbohydrate is hurting you, then it's time to change. Then you look at your mom and your dad. Like my mom had diabetes, and now she's in her 80s. My dad still drives her around. They would have been gone.
Really?
Yes, but I just brought in. But that's my real story. That's how
Do
I
they
got
live in
here.
Nigeria?
Come again?
Do they live in Nigeria? Auntie.
On and
You'll
off,
say,
on and off.
please live on one. We know you'll tell you, all these Japa people, they'll live there, they're not come to
Not really. So let's
How affordable,
I'm just joking.
how affordable is consulting with you as a wellness, for
Yeah.
a wellness plan? So if somebody is listening today and wondering, okay, I love what she said, but how can I afford it?
No, I believe we are extremely affordable.
Yeah.
You pay your minor consultation fee. I think we should not look at, I think wellness is cheaper than a funeral bill.
Yeah.
Yes.
Wow.
Okay, so let me bring it in another way. Many, obviously, you know, you've broken down a whole lot for us, checking the calories, checking our carbs, eating with intentionality of, is this thing going to make me better, or
Heal me or
it
kill
will
me.
heal me or kill me? I like that. But what would you say in your consultation you've seen is one of the worst choices that Nigerians make in terms of our food? Like you would say, these are the 3 things that you must stay away from, and the 3 things you must eat.
Okay, so the 3 things you must eat is that, like in Benue State and a lot of places I've visited, the swallow is this size and the soup is like this. Like in Benue, they literally take the swallow, put it in the soup,
Just
shake
dip
it. No, even shake off the soup.
Wow.
And yes, I've seen that happen, and I think all my Benue people will support me there for the most part. There's even something called uka uka, where you literally just eat the swallow and pocket one small soup and keep doing your swallow. It's done in this country. So what we can reverse is increase your vegetable and soup okra portion and shrink your swallow. So that's one thing you can do. 2, drink your water whether or not you're thirsty. Even going on a 1 to 3 day fasting is enough to clean your body and, yes, clear your dead cells and make you
What
refreshed.
does fasting mean to you? Like you eat break at 6 and eat normal food? Or
No
No,
food.
fasting to me means 24 hours.
you're not eating anything?
Yes, just stay on water. You will not be hungry. Because the first time I tried it, I thought I was going to die. Like, will I wake up tomorrow? But when I went all the way to 10 days, I realized that anybody can do 3 days.
10 days?
Yes, I
Just
did.
water?
Just water.
Auntie, I tried.
What was the
Anyway,
result?
we have to wrap, unfortunately.
Good
but-
health.
But
It
it's
was
important
good health.
It's important for us to just let you wrap up on lifestyle medicine. Why is lifestyle medicine in a nutshell? So we wrap up.
Okay, so why lifestyle medicine in a nutshell is because in Nigeria, as I see it, when we try to open Dr. Physique, they wouldn't open us, they wouldn't allow us to open because they said you're either going to open it as alternative or as orthodox. And Ministry of Health has data that shows that 80% of Nigerians, we are doing some form of lifestyle medicine misguided. So we now teamed up, we have about 100 staff strength, mostly
We have to go.
consultants.
Unfortunately, we have to wrap up. That's all.
Yes.
We can
Out of
do. You can always share more of your details on
Social media, they follow you from
I
online.
think one of the
done.
things that why this show exists also is to help Nigerians, especially those of you that have jackpot, to come to Nigeria and
I
are
have not-
fixing.
I did not
No, I'm just
jackpot.
saying, when I say virtual jackpot, just saying somebody that traveled to come and help solve. So those of you solving problems, we will give you our platform to show what you're doing, because part of what we want to do is embrace Nigerians, both home and abroad. Everybody who is solving problems, we'll definitely give you a platform.
But
to
she
do that.
read
So
book,
thank you
Sha.
so much.
I feel that we should just start from where we are.